How's it going, everyone? I'm Dr. Brian Veer at Binger Chiropractic down in Huntley, and today what we're going to be talking about is neck pain, specifically disc herniation or disc bulge that causes radicular pain all the way down into the hands. This can happen on one side, it can happen on the other side, or it can happen on both sides. And today what we're going to be using are these disc models. So this is a normal spinal segment coming from either the lower back, middle back, or the neck. And what we see here are the cartilage, the inside fluid, and the bones, as well as the nerves attached to them. So when we herniate a disc, what ends up happening is that we put too much pressure on the front of our disc, and it shifts the fluid into the spinal cord or the spinal nerve. And that looks like this. And what we see here is that the fluid pushes into the nerve, and that causes a tremendous amount of pain. Now, depending on where that fluid is hitting, you'll have different symptoms. Sometimes it'll only be in the neck or the shoulder, and other times it can radiate all the way down into the fingertips, giving you numbness, tingling, and all kinds of different pain associated with that. So, what do we do here at Binger Chiropractic is I take you through what's called a McKenzie assessment. And this is specifically to worry about these disc herniations and to shift the fluid off of the nerve. And so what that looks like is you have your head straight, hand on the chest, finger on the chin, and you're going to tuck the chin backwards and extend back as far as you can, and then land right back to neutral. And do that about 10 to 20 times. And what we're trying to do with that is to shift the fluid off the nerve, because it looks like this. As we extend backwards, we're going to be pushing the fluid back into the center of the spine. Along with that, I'll give you some adjustments to specifically break apart some of the tension and the tightness within the joint, give the nerve a little bit more room to move, as well as do some myofascial release. A lot of times when the nerves get compressed, the muscles will spasm to protect it. So we need to release those pressure on the nerve. So if you're dealing with neck pain, if you have any symptoms similar to that, make sure you give us a call and set up an appointment today, and I'll see you in the office.